Welcome back to the channel. My name's Dave. I'm a pharmacist, and we're talking about the most popular blood pressure medications today. The top 5 is what I will be focusing on. And after that, stick around. I'm going to show you a study that reveals the best time of day to take most of your blood pressure medications. If you take them at the time of day I'm going to tell you about, you could reduce your risk of cardiovascular death by around 56%. So definitely stick around for that. Number 5 most popular medication for blood pressure is hydrochlorothiazide, abbreviated HCTZ, and it's a diuretic. It works by increasing urinary output, and because it works that way, you're limited as to what time of day you can take it. So you want to take it right after you wake up. That way you're not disrupting your sleep with these frequent urges to urinate. The most common side effect is potassium loss. That can be avoided by, sometimes the doctor will prescribe a potassium supplement, but you can also avoid it by increasing your potassium intake through the foods you eat. And I recommend 8 to 10 servings of fruits and vegetables every day, and that will help with that big time. Another side effect, a little bit of an increase in blood glucose. Not a problem for most people, but if you have diabetes and you're dependent on insulin, your insulin dose may need to be adjusted. The number 4 most popular is Losartan. It works by blocking a hormone, angiotensin II. Angiotensin II is a potent vasoconstrictor. It constricts the blood vessels, kind of like pinching a garden hose. The pressure inside the hose goes up. So by blocking that, you're relatively decreasing the pressure. The most important side effect we worry about as pharmacists is an increase in potassium levels. So the doctor will typically monitor your blood for that. Losartan should never be used during pregnancy because it can cause damage to the unborn baby, and it should be taken at the same time every day. The next most popular is Metoprolol. It's a beta blocker, and normally adrenaline binds to beta receptors in the heart and increases heart rate and increases the force of the heartbeat. So by blocking that, we are relatively reducing heart rate and reducing blood pressure ultimately. Metoprolol should be taken with or immediately after a meal, and it should never be stopped abruptly, particularly if you've taken it for 6 weeks or longer. The reason for that is you can develop ventricular arrhythmias or you can have a heart attack. Now, both of those are potentially deadly, so it's important to keep in touch with your doctor, and when you're taking this, don't just stop taking it abruptly. Another side effect for people with diabetes, it can mask the signs of hypoglycemia, which is low blood sugar. Normally, you would experience things like tremor, fast heartbeat, and sweating. Now, if you're taking this, you'll still experience the sweating, but you're unlikely to experience the fast heartbeat and the tremor. Number 2 most popular blood pressure medication, Amlodipine. This is a calcium channel blocker, so it blocks calcium from entering cardiac and vascular smooth muscle cells. Ultimately, the calcium is needed for these muscles to contract. So by blocking the entrance of calcium into these cells, you get a relative relaxation, which ultimately decreases blood pressure. Because these blood vessels are relaxing, they're expanding, and that can push on nerves, cranial nerves, causing headaches. Also, peripheral edema, like swelling in the extremities, is common. And grapefruit with amlodipine should be avoided because there's a potential drug interaction there that's dangerous. And like the other drugs we were talking about, amlodipine should be taken at the same time each day. Now, the number 1 most popular blood pressure medication is Lisinopril. This blocks the conversion of angiotensin I to angiotensin II. So once again, the target here is angiotensin II. We want to reduce the effect of angiotensin II because it's such a potent vasoconstrictor. And just like Losartan, this drug can increase potassium levels, so the doctor will typically monitor your blood for that. Should never be used during pregnancy, should be taken at the same time every day. Dry cough is common with Lisinopril. I think it's around 1 in 5 or 1 in 6 people who take this medication experience this nagging dry cough, and they can't get rid of it, and they have to let their doctor know so they can be switched to typically Losartan, and there is no side effect of a dry cough with Losartan. Now, what's the best time of day to take blood pressure medications? The first one we talked about was hydrochlorothiazide, diuretic. We're limited by that because it's going to increase urine output. Can't take it at night. But there was a study analyzing which one was best, morning or bedtime administration of blood pressure medications. They looked at over 19,000 people with high blood pressure, divided them into two groups. One group took their blood pressure medication at bedtime. The other took their blood pressure medication upon waking in the morning. Here's what they found after watching them for 6 years. The people who took their medications at bedtime, their blood pressure medications, were 56% less likely to die from cardiovascular disease, 42% less likely to be diagnosed with heart failure, and 49% less likely to have a stroke. Wow, that's a magnificent benefit. Take it at bedtime if you can. That seems to be optimal. And check with your doctor just to make sure, your pharmacist too. Make sure it's okay for you. Now, people with high blood pressure, less than 25% actually have it under control. It's often due to inadequate or inappropriate therapy. Now, how do you know if yours is adequate or appropriate? Well, get a blood pressure monitor. It's not difficult. Check your blood pressure, same time every day, and keep a log, keep a record. And for $35, you can get a top-of-the-line blood pressure monitor. I have one that I did research on, lots of research, and there is a link to that particular monitor in the description below. So you can get that and start monitoring, start measuring. That's how you know. If you go to the doctor, it might be a fluke that your blood pressure is low at the time that you're there, or it might be a fluke that it's high. Maybe you have white coat hypertension, right? So monitor your own. Make sure you know. So check out the link in the description below. If you don't have it under control, you're more likely to have atrial fibrillation, heart failure, stroke, coronary heart disease. And also, there's a 12.8% risk of death associated with high blood pressure. So get it under control and watch it. Watch it yourself. I have a book coming out soon. It's in the works. It's for people who have had an ablation for atrial fibrillation or other arrhythmias like SVT or A-flutter, and they're interested in doing everything they can to minimize the risk of having another arrhythmia going forward. And if you're interested in that, I will be making an announcement once the book is available on this channel. Thank you for tuning in. I'll see you next time.